So today we're going to talk about clinical documentation, keeping accurate and effective notes. So the objectives are to understand the purpose of clinical documentation, to learn the components of effective clinical notes, explore examples of good versus poor documentation, and to review legal and ethical considerations. Clinical documentation is the backbone of healthcare. It is the record of patients' medical history, including treatments, diagnoses, and care plans. It is very vital for legal protection and financial integrity. So why does documentation matter? So it matters for legal care of plan. So healthcare providers must adhere to numerous of regulations, communication between providers to make sure that nothing is taken out of context, to make sure that there is nothing in the notes that's being missed as regards to the patient's care. For billing and reimbursement purposes, so if there's something that's inaccurate in there or incomplete, it can lead to delayed or denied claims, and it can affect both the patient as well as the healthcare organization. Quality of care and assurance and audits. So this is like analyzing like the documentations for each of the healthcare organizations so that we can make sure that this is being improved overall to make sure that you get the best quality of care. So that's why that matters. Patient safety and continuity of care. So when you're talking about clinical documentation, that serves as the communication, like the best communication between the different facilities or the different doctors that you're going to see. So if you're going to be transferred to another facility, you don't want anybody to start over with you because they may not know what's going on with you already. So having this already documented before you transition to another person's care, makes the process pretty much seamless. So I like to start with some statistics because I think that this matters a great deal. So 86% of medical errors are due to miscommunication. Clinicians spend an average of 4.5 hours a day on electronic health records. Now, some spend more than 4 hours a day, but on average, I'd say 4.5 hours. 1 in 5 malpractice suits involve documentation errors. And the source for this, if you do want to go look that up, you can check out the AMA, you can check out other health affair journals. Key principles of good documentation. Timely. Document as soon as possible. So whenever you are doing that care or done with that care, you should be documenting it. For accuracy, use the exact facts and observations. Don't document something that you did not see or hear. Make sure you're using the exact facts. Complete. Include all relevant details. Concise. You're going to clear and to the point, get clear and to the point with it. And make sure that it's legible. Handwritten notes must be legible. You do not, that's one of my pet peeves, because I don't want to, the one thing that you cannot do in healthcare is guess. You have to know. And we all know, look, doctors, even some nurses, some other practitioners, they have a lot going on. They're writing a lot, they're dictating, they're seeing a lot of patients. Some of them, in my experience, have been some scribble writing, and I don't like trying to piece things together. So I really appreciate the doctors and their times, and I appreciate all the doctors that I have encountered, because I've been able to read their handwriting. But there are a few in there, but make sure that your handwriting is legible and then objective. You want to avoid opinions and personal judgments. So what do you include in a clinical note? Well, of course, you're going to need the date and the time. You're going to need some kind of identification, so make sure you have the patient identification. And then what's the reason for the visit? Why the patient is here? The chief complaint. You're going to need your observations and findings, like what did you see? What did you observe? And then your interventions that you provided. You're going to need a patient response. You're going to also need the plan of care or the follow-up, like how we're going to plan this out. And then, of course, your signature and your credentials. So we're going to talk about some SOAP notes. So SOAP notes is a method of documentation that's used by healthcare professionals just to kind of help record the interactions. So this SOAP note format, S is for subjective. What the patient says, example, I feel anxious. The O is for objective. What do you observe? What are the measures? What do you see? This is something that's visible. Assessment. This is your clinical impression. So I see the patient has a diagnosis of XYZ, or the patient has this, or I found this. P is for plan. Next step in the care. You're going to plan the next step in the care. So the patient going to do therapy, the patient's going to have a counseling session, the patient's on medication per the doctor's orders. So here's an example of a good SOAP note. So your S, patient reports sharp pain in the lower back. It's 7 out of 10 and it worsens with bending. Limited range of motion. Positive straight leg raise on left and vital signs stable. It's likely sciatica because I've assessed the patient. And then what's the plan? Ibuprofen 600 milligrams 3 times a day. Heat therapy, and we're going to follow up in 1 week. This is a good SOAP note. You have your subjective. The patient reports what they felt, which is 7 out of 10 pain. You have your objective, what you observe. You observe that the patient can't move their limbs as they would normally move them. Limited range of motion. And then you're assessing them. Okay, it's likely some sciatica going on. And then the plan of care, this is what's going to happen. The patient is getting ibuprofen 3 times a day. She's using heat therapy, and I'm going to follow up with her in 1 week. Another example of a good SOAP note. Patient reports chest tightness when walking. Okay, this is subjective. This is what the patient said. The objective, blood pressure is 140/90, heart rate 98, respiration is 22. The ECG shows sinus rhythm. The assessment, possible angina, because remember, this is your assessment. Possible angina. The P, what is your plan? We're going to administer nitroglycerin. We're going to monitor the patient, and we're going to refer the patient to cardiology. Now, obviously, there are going to be multiple people that's going to be watching this training. Just put your examples into your own scenarios. So if you're not a doctor, of course, you're not going to be the one that's prescribing. You're going to be following the doctor's orders, of course. And these are examples of poor SOAP notes. Patient feels bad, back hurts, back pain, gave meds. This is a lack of detail. There are no details, there's no clarity, and the professional tone is not there. Here is another poor soap note. Says chest pain, not breathing right, something wrong with heart, gave meds, vague, lacks measurements, no clear plan. Yeah, there's a lot that's wrong with this. Patient says chest hurt. Okay. That's very bland. Not breathing right. Okay, well you didn't really say enough of that. You said the patient is not breathing right, but what else? So this is very vague. This lacks no measure and does not have a clear plan of what's gonna be next. So we're gonna go over some legal and ethical tips. So you're gonna never alter a record after the fact. So once you document it, you should not be altering it. Now you can addendum, but your original message should stay there. You're going to use correct protocols. So one line through errors, then you must initial. Document refusals, education provided, and unusual incidents. If the patient refuses something, that is the patient's rights. We cannot force anything on the patient. So make sure that you document Miss Jan refused treatment today. Miss Jan was educated on XYZ. That has to be in the notes, because even though Miss Jan refused the treatment and the family comes and say, or there's an audit or something, and they come and say, oh well, this is not done, this wasn't done, and then you say, well, Ms. Jan refused it, but that's not in the notes. You didn't put that in the notes. So that has to be in the notes. We have to make sure that we're protecting these patients' privacy, following the HIPAA compliance. So make sure that you are protecting their privacy, but you do want to put everything that you can in those notes. If the patient refuses something, if the patient says this, it has to go in the notes. Otherwise, it wasn't done. So electronic medical record tips or electronic health record tips. You're going to avoid copy-paste errors. Now, I'm going to be very honest with you. I do this a lot because I am working on multiple screens and I'm probably working on a million things at one time. So I document in a lot of different areas and then I'll copy paste. But sometimes I type too fast and I'll make an error or something. So you want to make sure you avoid that. Make sure you are reading it thoroughly. You're going to check templates for accuracy. Update changes in patient status promptly. And then when you are done, log out when you are not using it. I used to get fussed at about this all the time because I feel like when I'm on the computer, it's like, oh, I need to go run to the kitchen or to the break room to get a snack. And I get up and I go run there because I'm still working on my computer. But you don't know who's going to come behind you. It doesn't have to be a patient, because this can be behind those walls. This can be anywhere. It can be amongst your coworkers. You do not want anybody to have to go in and document nothing under your login or under your name. So make sure when you are done, log out. If you're not using it, log out, lock your computer. That way there are no errors that are under your watch that you didn't do. So let's do a multiple choice question. Which of the following is an example of objective documentation? And these are your choices. Of course, I gave you the answer. The correct answer would be C. Patient's pulse is 88 beats per minute. Now, why would it be C? Because it's objective. It's something that is there and you can see it. And if you want to think about objective, think about an object, something that you can hold. That's usually what how I remembered it in school. The next question, what is the correct order for the SOAP format? And that answer would be C also. It's subjective, what the patient feels; objective, what you can see; assessment, how you assess the patient; and then what do you plan to carry out with that patient. And some reminders. If it was not documented, it didn't happen. If it's not in those notes, it did not happen. Be professional. Your notes reflect your care. Be professional. Your notes reflect your care. Use standard medical terminology and abbreviations. And some questions to think about and discuss. What challenges do you face with documentation? What tools or templates have you documented? What tools or templates help you document better? So think about this. Have a discussion with yourself or amongst your coworkers or your peers. What challenges do you face with documentation? We can all use some improvement. So what kind of challenges do you face? Another thing that we want to remember, you want to always, in every situation, you want to CYB or CYA. Cover your butts. Because anything can happen. If you didn't put it in those notes, then it was not done. It is the auditor or the organization or the patient's word against yours. And guess who's going to get the shorter end of the stick? It will be you, not the patient. You want to document as if at the end of the day or the end of the week, you have to go to court. Document as if you have to go to court. You want to make sure you cross all of your T's, dot all of your I's to make sure that you cover your butt. At the same time, we have to make sure that we are taking care of the patient, we are protecting their information, and we are making them feel comfortable and building a trusty relationship with them so that they can trust us, with their information. So make sure you're documenting it. Don't be afraid to clarify something with the patient. I've had to call a patient back and ask them a question or two. Hey, did I go over this with you? Make sure you are educating the patient. If the patient refuses something, please put it in the notes. Please tell them, explain to them the importance of it, but don't make them feel bad because they do have the right to refuse something. We just have to make sure that we are documenting it properly on our end so that we make sure that we take care of us so that we can be here, keep our jobs, and continue to take care and protect our patients. This concludes our training, guys. I will see you next time.